better, but it doesn't sound like it. Let me go through really quick how to do the knee rehab, put the knee back in place. So we're going to start with the simple stuff that I showed you last time. You just let the foot drop down like that. You want to scrunch the foot as you gently push on the ground as you lift this piece up and lift this piece up. The front of your pelvis, you want those up. You want to try to get your anus right over the top of your ankle. And if you want, you can, have somebody push right into the back here. This is hard for you to do, but you can have somebody gently push on the back here, especially up here at the top, while you're stretching like that, and that can help to slide things in. And again, certainly do both feet. The second movement is similar to the movement that I taught you about what are called heel pulls. So you're using the backs of your legs to pull up your arches to get your arches to rock. But in this case, we want you to do one that is standing. So you'll be doing that standing rock. And when you're pulling that back and you put a little pressure on this leg, either up by the hip joint, probably the best place to start as you're rocking back. Again, sticking your butt out as you do that, stretching that as you pull and arch at the same time. You can kind of push that hip joint back in and even line up the knee a little bit from the front. Okay. Again, we also talked about the ice, 3-4 bags, lots of ice, got to freeze what is an awful lot of tissue around your knee. You got a big knee. The heat just needs to heat it back up in between. If it's really hot from being sore, it's not going to take a lot of heat in between. As the knee gets better, you'll need more heat. And the easiest way to get heat is just to put hot water in Ziploc bags. Or you can order 2-3 hot packs or something. But you really want a lot of heat. The last maneuver, again, how to put the knee back in. You'll be laying down on the ground like this. And you'll be putting your leg up like this, and her knee is going to go right under there. So she can either go under there, and that's probably the best spot, but she can literally go to any of those spots. With the chair, she's pushing up, and that allows. Okay, another way of looking at this is, if you put a chair underneath and you put the ball here, you're kind of pushing down with your heel on top of the ball and it's pushing up into your leg, and you just want to hold that spot. I would think, the way you described your knee, you may have to hold it for 4 to 6 minutes the first time. Don't press in so hard that it really hurts. Try to just very gently be on that pain border. But the first time it may hurt regardless. And after you do a few minutes there, you can move it down, move her knee down, or I guess you could even use a ball like this and again push down with your heel, and that pushes into the ball, and that compresses the muscle and very slowly squeezes the blood and lymphatic fluid and everything else, intracellular fluid, out of that muscle, and the muscle just naturally relaxes. To get the knee back in place, you're going to want to put her knee right underneath your knee right there and just push down, and if everything relaxes after 4 or 5 minutes, it should hopefully just slide in a little bit closer than the last time. And let me know how that works.
Okay.
Thanks a bunch.
Mm-hmm.